Hello guys, this is Brian here with a video. One of my YouTube subscribers had asked me to do a video about what happens during the spinal cord stimulator psychological exam. More information about that. And I'll post her link to her channel below. Her channel's the name of the channel is Dawn's Craftyroom. Check her out. Subscribe to her. She's in the process of getting a spinal cord stimulator. If you see a lot of junk in the background, we're doing a lot of cleaning around here, and there's just junk all over the damn place right now. Going to different bins, getting sorted, getting thrown out in the trash, donated, what have you. And I don't know 100% for sure what is the reasoning behind of having a psychological exam for a spinal cord stimulator. Now, I do know for sure, I do know this, at one time or another, Blue Cross Blue Shield, my insurance, Blue Cross Blue Shield Texas, they did require it to have a spinal cord stimulator done even before the trial one. So I don't know if that was part of the insurance company's process, because when I looked after I had it done, Blue Cross doesn't require that anymore. So I don't know, maybe the FDA requires it, or the device manufacturers, what have you. So I really just don't know what the real purpose of the psychological exam behind that. She wanted to know what kind of questions I have to ask, so I'm going to tell you what kind of questions I have to ask. I can't remember if I did go into much detail about that in my videos or not. The way that it really goes down, and the way that they get connected with you, is your pain management doctor who's doing the implantation says, hey, we got to have a psychological exam that's required. They then send the referral to the people who do those. I forgot what they call them. I don't know what they call them. Psychologist, psychiatrist, psychologist. I don't know what the difference are between those two. I know one can write medication and one can't. One's really considered like an MD, maybe. I could be completely wrong on that spectrum. But there was a little bit delay with me, with my insurance company, because I have Blue Cross Blue Shield HMO, where we all know HMOs require referrals. And the office keeps saying, well, no, you really don't need a referral. Well, Blue Cross keeps saying I did. And when the primary care doctor, something went wrong on their end, getting the referral in, and it was just a bunch of bullshit. And it ultimately turned out here in Texas, a HMO referral is not required for behavioral health, because that falls under the behavioral health benefits of Blue Cross Blue Shield. It's not really them that processes the claim. It's a third party called Magellan Health, Behavioral Health Services. So it falls underneath that, so therefore it does not require HMO referral at all. So finally I got all that straightened out after hours upon hours of phone calls with my body. I really, personally, I don't take somebody's word 100% for sure, because ultimately I could be responsible for the bill. And we all know these insurance companies, ever since Obamacare got kicked in, they use these third-party contractors or third-party call centers, and they don't know what the hell they're talking about. And I finally got somebody at Blue Cross, a big supervisor, because I called, instead of calling customer service, I finally had the brains to call, I'm going to call the pre-authorization department on the ID, the telephone number on the back of the ID card, for hospitalizations and things like that. And the supervisor said no. Ultimately, she 100% for sure said no, you don't have to have an HMO referral to do any kind of behavioral health, because that falls underneath the behavioral health benefits here in Texas. I don't know what other states if you have HMO or not, but here in Texas, I think the county law says no, patients don't require HMO referrals, because that stands in the way of getting treatment. Anyways, they had some of my information already, and when I went in there, I filled out a little bit more paperwork and all that. As far as the paperwork didn't really go into much asking why I was there or anything like that. Now, if I do remember correctly, it did ask me if I felt any kind of depression or anything like that. And rest assured, these people are experts, and rest assured that they're not going to blurt out why you're there. And they were, for instance, the lady who checks you in, they're not going to open up the little window and say why you're there. They took my privacy very seriously. They should take everybody's privacy very seriously. Although I didn't, I was there for a psychological exam for a medical procedure. So there is other people in the waiting room that, there are regular patients of this, the practice, and they see a psychologist or what have you for, for a variety of reasons. So don't feel comfortable there either. I was kind of nervous at first, because I didn't know how, I didn't know, how deep this person is going to ask all kinds of questions about, personal life and things like that. And I was worried for nothing. Now, I would say this, it's up to you how open you want to be, or how much detail you want to give that, about certain things. That's up to you. Don't lie to them, obviously. I mean, they're kind of experts. If they can tell if somebody's lying, I bet. But don't go in there trying to stretch the truth or anything like that. Don't try to be dishonest. The type of questions they ask, if you ever have self-harming thoughts or suicide thoughts, same thing. Do you feel depressed or what have you? They ask weird questions like, "Oh, do you see a pain management doctor?" like that. Like they're trying to see if you are being honest with them with those type of questions. I mean, obviously you say, "Well, I just go pain management doctor just get prescriptions." Obviously that would not be a good candidate for a spinal cord stimulator. And they ask you, what kind of test have you have done for your medical problem and things like that. They did ask me what kind of medications I do take often and things like that. I did tell them, obviously. I did tell them it's kind of complicated with my particular medical situation. That the medications, like for instance, normally people who don't have any weight loss surgery, like gastric bypass or lap band or what have you, usually people with who don't have that, they can take steroids in to eliminate or get rid of the inflammation that's in your body that's causing a lot of pain. Well, I can't take that. If I do take steroids, I have to take a whole slew of other medications to protect my stomach. I would have to take an antacid. I would have to take a liquid called Carafate, which is very nasty, to coat the stomach so you don't develop an ulcer. All kinds of other medications. So you take one little pill, prednisone, but you have to take 5 to 8 to counteract the effects of that. And with my weight loss surgeon, he just totally don't recommend him doing that. I mean, why take a chance to develop a serious stomach ulcer? And stomach ulcers are very, very dangerous. So therefore, it eliminates somewhat treatment options. Now, of course, I could do the steroid injections. Well, the downside of that is weight gain. So, you have to explain your situation to them. For instance, I take an anti-seizure medicine, even though I don't suffer from seizure. I take that for nerve pain, gabapentin, which I do believe, if I'm not wrong, that is considered a anti-seizure medicine, and it's used for nerve pain. And I'm sure they see it all anyway. So, you just have to explain your situation. And they also ask you, how's your home life? Are you safe at home? And And also, like again, did you suffer from any kind of depression and things like that? How do you go about your daily activities? Now, don't stretch it. Even though, if you ever had back pain, or if you do suffer from chronic pain, we all know that doing daily activities is extremely, extremely difficult and hellish. And no matter what you do, that pain never goes away. We all know that, but I don't think the medical profession really knows that. Like, oh, you hurt your back a little bit. Well, yeah, do some exercises to feel better. That's a bunch of bullshit. I'm sorry to say. If you hurt from sitting still, you think I'm going to be jogging around the block, even though I do need it? Jogging around the block, do you think that's really going to help the pain? No. So don't stretch it. Don't stretch the truth about that. But do tell them, yeah, daily activities is very difficult. Don't say you sit in bed from 8 a.m. to midnight, not doing one single thing. I mean, don't say that. That won't be very good. Even though I have done that myself, but because I have had times where I had I don't know if you really call it a back spasm, or when their hernia disc got so bad, agitated for a week or two at a time, that yeah, I would sit in bed and can't lift a finger, and really it would hurt to breathe actually. And that's when the time I would have to be on the heavy duty narcotics, and then you can't drive, you can't really do nothing really. You have to take it extremely easy, but it's really up to you on that. I would just say, just be careful what you say. Word it, just be careful on the way you word things. I have found that when people, because I have witnessed myself, just, don't be demanding. Don't go up to the psychologist's office, say, I demand this to be approved, I demand this, and I demand that you write a good letter of recommendation. I mean, don't be demanding, obviously, because I have heard people in the doctor's office be demanding to the doctor, and of course the doctor's not going to give in. The doctor is there to provide a service, and yeah, you paying part of it, or the insurance company's being part of it, but at the end of the day, the doctor is human like anybody else, and when somebody gets in my face and be demanding, I won't do a damn thing. I won't lift a finger either. But don't stretch the truth. Don't bend it. If you kind of read between the lines, be honest as much as you can. And they ask you about your home life and things like that, and about your family. And I think he did ask me if I had any prior back procedures. I can't remember 100% for sure about that. And they will ask you, what are your real expectations for this device, for the implant? And of course, my expectations, because I talked to the doctor, several different times, and I told him, my real expectations is to help with the pain, but it's not going to eliminate 100% of the pain at 100% of the time. And of course, I do expect some medication, reduction in medication and things like that. Will it eliminate 100% of the medication at the particular time? I said, I don't know. Maybe, maybe not. We just have to see. Take it one day at a time. But I just really can't, just flat out say, I don't expect this to be 100% cure all and never experience pain ever again. And he asked me, how was my pain affecting my job? And I was really, really honest about that part. I said I was almost at the end of my rope. I was either going to have to file for short-term and long-term disability through my employer, or I would have to file Social Security disability through Social Security. I was at that point. I was almost at the point of unable to do my job. And there is a little caveat about long-term disability. Under the law, the Family Medical Leave Act, the employer must provide, it also depends on the employees, but usually I think it's more than 50 they have to, that they must provide 12 weeks of leave. Now, it doesn't have to be paid, but it has to be paid, 12 weeks of leave. After that, they could terminate you. So, even though our long-term disability policy can go up to age 65, or even when you get eligible for Social Security, well, if you're terminated from a job, you don't get that. I don't think. Because employers love to terminate people after they go beyond that 12 weeks. And you know who is the worst offender of that? UPS. You know the people who drive the brown trucks? UPS. They have a reputation of that, especially here in Texas. And so, it just is a little way, you gotta weigh your options about that. You actually have to get an attorney involved and figure out disability. With our disability, our short term is AFLAC, and when we first got it, there's different options. Well, you can either choose the short term for a month, 3 months, 6 months. I chose mine to be 6 months, the maximum, so it can overlap the long-term disability in case there's always because it always takes forever for them to. Well, AFLAC doesn't take forever, but the long-term disability, I've heard that they take forever to approve. I kind of got sidetracked, but really, in reality, they just asked various questions. He asked me how am I able to drive a vehicle. I said, not very long. I have to get out and stretch and change. Stretch. Get out and stretch the car. Out of the car, not stretch the car. Get out of the car and stretch. I told him I couldn't sit on hard surfaces like a bench at all. But that's about it. I mean, they don't dive into extreme details of your personal life. But just be honest as much as you want to be honest. He didn't ask me any questions that I felt uncomfortable. Now, if he would have asked questions that I felt uncomfortable answering, I would say, I do not want to answer that. I felt uncomfortable answering that. But I don't think they will. Also, they ask you if you have any substance abuse problems like drinking, taking pills, and all of this. One little side note here. I don't know if anyone else has experienced this if you go to a pain management doctor, but I sure have. There seems to be, and the media kind of pushes this narrative too. It seems to be there's a stigma if you say you go to a pain management doctor. Because a lot of people don't understand why a person ends up at a pain management doctor. In my particular case, I ended up going to a pain management doctor is because he's the one who does the procedures I needed. Steroid injections in the spine. The spine doctors don't do those. They're too damn busy making money doing spine surgeries and things like that. They call neurosurgeons. So the pain management doctor is the one who did these injections in the spine or the neck or the back, what have you, and things like that. Because I have even experienced a little, a bit of stigma, even in a medical setting. One time I went to the emergency room for a severe migraine, and of course, they can pull up all your medication history. Here in Texas, they can, and they do. They can see everything that you've been prescribed. But I give them a list anyway, so, you up front. And he asked, well, who prescribed you the tramadol? He recognizes the name because the doctor is the one who works at the same hospital, right? And I said, oh, I see him, to have steroid injections in my spine for a herniated disc. And the doctor was kind of, did you sign any contracts so you can't get pain medicine? I said, no, no. That's not my particular deal at all. Now, I'm sure he went somewhere else and, and called the doctor and checked on that probably, but, because I have checked it out, some pain management clinics makes you sign a contract stating that you can't go to multiple doctors and get prescriptions and things like that. And you're subject to urine tests and all that. I never was forced or made to sign anything like that. Some people may, some people may not. It just depends on the particular doctor and things like that. And also, I have even experienced in my own family that they kind of look at you weird. And when they ask you for, what kind of doctor are you going to? What have you? And I said, I go to a pain management doctor. Because people who are not familiar with that, people automatically assume that people go to a pain management doctor to get pills. They go to a pain management doctor for a made-up condition that's not real. Pill mill. Now, of course, there are some bad doctors out there, I think I heard on the TV, if it's true or not, the media, that the state of Florida has the worst pain management doctor, the pill mills out there. And they were everywhere. But the media kind of hypes it up too. So, yeah, I have even my own family at first didn't understand why I ended up going to a pain management doctor, just because in my certain circumstances, they're the ones who performed the type of procedure I needed to have a steroid injection done. Also, a lot of people go to a pain management doctor who have severe illnesses that there is no cure for, or even or end up onto a pain management doctor that it may be that they're in pain because the procedure that they need is too dangerous to perform. That's almost similar to me, almost, because a lumbar fusion for me is extremely dangerous at my weight. So there is no other medical treatment besides pain medicine and spinal cord stimulator. So those are really, that's it for me. I mean, there's no other treatment. So people do end up there who have no other treatment options available. And also, people who have severe cancer. I see that in the pain management doctor I go to, or end of life as well. So there could be different varieties of why a person goes to a pain management doctor. So I don't necessarily tell everybody if they ask. I really don't. Maybe, of course my family doctor knows, obviously, because he has to do their HMO referral. And obviously the spine doctor knows I go to a pain management doctor. And obviously the neurologist who I see for migraines, he knows because he also referred me to them for neck injections for my migraines in the neck, because I had a disc problem in my neck too. So now if my GI doctor asks me, I probably may not say anything. Although, like I said, here in Texas and also in most states, that doctors nowadays can pull up everything that you've been prescribed and by who. So, that's a caveat between that too. But if a regular, like a coworker or a family member asks me, I probably, like a family member that's not close, I probably would not tell them. Because like I said, they don't understand. So yeah, I think there is a stigma out there about pain management doctors, and a lot of people don't understand. And also, the media, this is what I'm really tired of the fucking media about, is if you take any kind of narcotics, Vicodin or what have you for pain, they kind of label you as a pill popper. And that's not true at all either. Now, of course, the pain pills are dangerous. Of course, they're addictive. But like I said again, what are you going to do with the people who don't have any other treatment options available? You're going to let them sit there in the corner in severe pain? I don't know if the media, NBC's really pushed that narrative, NBC News, for the last year or two. They say that these pain pills were never designed for long-term use. Well, maybe so, but like I said, what are you going to do with people who have no other treatment options? You can't let them sit in the corner and rot away. I mean, it just don't work that way. So hopefully this answered all your questions. I kind of went off sidetrack lots of different times. But moral of the story is, be much honest as you can. If they ask, I don't believe they will, but if they ask certain questions that you feel uncomfortable, just tell them I feel uncomfortable answering that. The guy who did the deal on me, he did tell me right afterwards I was a good candidate for a spinal cord stimulator. So they should tell you that, or, maybe when they type up the report. They were nice enough, because I did ask them if I could have a copy of the letter that's sent to the doctor's office, because you can get that, because it is part of your medical records. Anyway, also, by the way, if anyone's going through the process of getting a spinal cord stimulator, get copies of all your medical records. I get copies of mine all the time. Most of the time they don't charge. Sometimes they do, but most of the time they don't. Because if the insurance company gives you a hard time, you can do an appeal, and here's all the medical records. I got hundreds upon hundreds of pages of my medical records. But that's just, just always have them for your protection. As well as I have all the imaging. Well, of course they give you imaging discs when you have MRIs and CT scans, but I also got the reports too. Don't let the doctors keep all that. Now, the imaging places will give you the CD, and also they should give you the copy of the report too. Because what happens if you have to change a doctor? You have to wait on them to do all the medical records transfer, all that crap. I have been in that situation where the imaging place says, "Oh, we did fax it," and the doctor's office don't have it. You have to play the waiting game. You have to play the fax game. I don't play that shit. But I hope this does answer any of your questions about the psychological exam. I don't think I filled out a whole bunch of paperwork. It wasn't lengthy or anything like that. Because I remember I kind of filled out lengthy paperwork just to have physical therapy. They ask you, can you lift 5 pounds? And it was nothing like that. Just basic doctor's forms. And I think I was there less than maybe 30 to 45 minutes from start to finish. But they ask you those type of questions. I'm just rambling on. I'm tired right now. But if you do have if anyone does have any further questions about this, just let me know and I'd be happy to answer. Talk to y'all later.